I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined by Dr. Antonio Wolf. He's a medical oncologist here at Johns Hopkins. He's going to tell us a little bit about what patients need to know as they're finishing treatment for early stage breast cancer. Hi Dr. Wolf, it's good to have you.
Thank you for the opportunity.
Will you tell me a little bit about what you hear from patients after treatment, both physically and emotionally?
I think one of the major challenges for patients when they're finishing their initial treatment is first and foremost fear. As they are just dealing with a new diagnosis of cancer and they're trying to figure out what exactly this means, and am I going to make it, am I going to survive this? But as patients begin to move away from that initial moment with a lot of reassurance from us that they are receiving good, combined, multidisciplinary team care, we start to help them begin to transition into the rest of their lives and moving away from a sense of a state of disease, but also what do I need to do to regain my health?
We like to tell patients that they're their own best advocate after breast cancer treatment. Can you tell me a little bit what patients may need to know or they may need to tell their primary care doctor at the end of treatment going forward?
I think a lot of it starts with us as part of the healthcare team, both physicians and nurses and social workers and nutritionists and everybody who is involved in the care of that patient, is to try to educate them a lot about what they are going through, the medications they are receiving, the treatments that they have received, and understand some of the potential side effects that they have to deal with related. So a young woman who's receiving adjuvant chemotherapy may stop menstruating, may begin to have hot flashes. An older woman who's receiving an aromatase inhibitor as anti-estrogen treatment for breast cancer, she may have joint aches, bony discomfort, she may have high cholesterol, a lot of these things that she should be aware of, and so she can help pass the information to the primary care physician, because many of the patients are seeing primary care physicians who are not part of the same system and may not have access to the same medical records.
So it sounds like a primary care doctor is really key to making sure that a woman's overall health and wellness is taken care of after breast cancer treatment.
It is so critical for a woman to engage, for a woman to activate her primary care physician. And many patients don't. Many patients are doing well many women are doing well to begin with and may not be seeing a primary care provider. And I actually would include the gynecologist as a key element in that as well. But especially with the disease that I take care of, breast cancer, most patients today diagnosed with early stage breast cancer will survive their diagnosis, and they will grow older. And as they grow older, breast cancer becomes a thing of the past. And we, as cancer specialists, become less and less important. And the woman needs to be aware of everything else that she needs to do to remain healthy in decades to come.
I hear from patients a lot that they want to know what their follow-up guidelines should look like. Can you talk a little bit about what you recommend for patients? Should they be getting mammograms? Should they be getting MRIs? What other screening and surveillance should they be taking care of?
Things are actually simpler than many people believe. And the most important thing is listen to yourself, listen to your body, and report anything different, anything unusual to any of your physicians. Once the patient finishes the initial busy part of their treatments, so for a woman with early stage breast cancer, she may be busy with surgery, then she may be receiving some adjuvant chemotherapy. Depending on what kind of surgery she had or state of the disease, she could be receiving radiation, and then she may or not be receiving anti-estrogen medications for a number of years. So you could have several physicians involved. You could have the breast surgeon, you could have the plastic surgeon, the radiation oncologist, the medical oncologist, and we need to bring into the mix also the primary care physician. So on a rotating basis, after they finish their initial part of the treatment, that patient will be seeing, that woman will be seeing various physicians a couple of times a year. And you don't need, and you should not see everybody all the time. So initially, anywhere from every 3 to 4 to every 6 months, you're going to be seeing someone.
I think you bring up a good point about getting into a rotation. Are there other tests that patients should be aware of and other things that they may not need to be doing after breast cancer treatment?
think it's amazing that there's a lot of emphasis on the reassurance that a piece of paper with a test that says normal can provide you. The challenge is that not all tests are as good as we would like them to be in terms of their ability to identify problems. And sometimes tests may come back, as we call it, with false positive results. And I make the analogy that a false positive test is like a ghost. It's something that doesn't exist but scares everybody, raises anxiety in the patient's mind and also with the physician. So I would say for, in the case of breast cancer, for a woman who is doing well, who has no specific symptoms of concern, who has no abnormalities on the clinical exam, in all likelihood, there's not going to be any routine surveillance follow-up test that she will need on a regular basis. She definitely needs to continue with mammography on a regular basis of the same breast if she had breast conservation, but also of the unaffected, the other breast, because she is at risk of developing a new unrelated breast cancer. And she needs to continue other surveillance or screening tests, such as if she's going over the age of 50, maybe start thinking about colonoscopy for screening, as well as see your gynecologist and continuing appropriate tests. But the message is keep it simple. And if anything unusual shows up, bring to the attention of one of your healthcare providers.
I hear from patients a lot that they may equate more testing or scans with better care. Here at Johns Hopkins, if a patient isn't having any symptoms, we don't necessarily recommend things like bone scans or blood tests. Is that correct?
That is correct, and I think we've learned over time that, again, we want to do tests if they appear to be indicated. So if a woman presents with specific abnormalities or discomforts or pains or aches, then we may target, we may order a specific imaging test, a specific radiology test to answer a specific question, because it reduces the risk of having what we call a false positive test, which means nothing and sometimes puts patients through even unnecessary procedures and risky procedures such as biopsies.
A lot of times patients ask what they can do to stay healthy after breast cancer, what they may be able to do to reduce the chances of a recurrence or a new cancer. Are there things that you recommend that patients can do?
It's actually very important to be active, and I think one of the great lessons, and a lot of patients, they wake up to the fact that perhaps I should have been doing more and I wasn't doing much. But a lot of people are active to begin with. They exercise, they run, they swim, they walk, and I think we encourage patients during treatment, not to let go. If they were active before treatment, please do remain active and definitely be active after treatment. And for those who have not done much before, this could be a good opportunity to adjust lifestyle. I think it's hard to say change your lifestyle, but adjust, shift things a little bit in a good direction. We do have evidence that patients who are physically active are less likely to potentially have side effects from treatments. In terms of lymphedema, there's some evidence to suggest that patients who are doing physical actions with the affected arm are less likely to develop lymphedema. And there's also some suggestions now showing that patients who are able to maintain their weight and perhaps even lose some weight over time, but definitely avoid gaining weight, may potentially have a better outcome from a breast cancer standpoint. So be active, it's so critical.
So it sounds like finding a balance between being active, staying healthy, eating right, reducing stress is really important after breast cancer.
Absolutely, and you have all the other potential good effects and benefits of a quote-unquote healthy lifestyle. As I mentioned before, most patients with early stage breast cancer, their public enemy number one as they grow older is not going to be breast cancer. It's more likely to be heart disease. So when you're talking about maintaining your weight, remaining physically active, you're talking about reducing the risk of heart disease, reducing the risk of type 2 diabetes, and obesity, and everything else that you need to be able to transition from simply being a breast cancer survivor, but actually to be a healthy individual and moving on with the rest of your life.
So when patients are done with treatment, what are some indications that things may not be going right, some problems that may be coming up, and they may want to come back and see you?
just because they had, first and foremost, because they had a cancer diagnosis, it doesn't mean that every single ache and pain that they may have over the next months or years is going to be breast cancer related. So none of the diagnosis of having had a diagnosis of breast cancer or the treatments that they have received do not, quote unquote, protect you from other health issues. But I think patients should remember that usual aches and pains, colds, things that come and go are more likely to be of no clinical significance and potentially something that doesn't need to be brought to the attention of their physicians. But anything that appears to be new, that appears to be different, a new ache, a new pain, discomfort, a rash in the chest wall, a new lump, something that is different and it doesn't go away and persists beyond 1, 2, 3 weeks, that would be the time to bring it to the attention to any of the healthcare providers that they have a relationship with. And that's why it's so critical for a woman, if she does not have a relationship with a primary care provider, this is a great opportunity to establish one, because that individual will more and more have a central role in long-term follow-up, and gradually all the cancer providers, the cancer doctors will gradually move out of the picture as time goes by.
Thanks so much. This has been really helpful. You've given patients lots to think about as they finish breast cancer treatment. Thank you so much for joining us today. I hope this was helpful.